At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome to GLI Live, the Global Liver Institute's Thought Leader interview series. I am your host, Donna Cryer, the founder and CEO of the Global Liver Institute, lovingly referred to as GLI. And I am very excited that we are bringing you very special episodes throughout October to focus on liver cancer. We have the privilege of uniting the global community in oncology and healthcare writ large around issues of public awareness, policy, and clinical practice needs and solutions in liver cancer. And so I can think of no better guest to help me discuss some of those clinical needs and solutions than award-winning nurse navigator Cindi Cantril, who is the owner of Cantril Cancer Resources and Recovery Services. Hello and welcome, Cindi.
Thank you. Thank you for having me.
Absolutely. I've been so excited for this. No one loves a nurse or nurse navigator more than a patient of my extensive healthcare needs. But first, for those who have not been as privileged as I've been to have encountered the miracle of nurse navigation, please tell us what it is, how it differs from registered nursing, case management, and other things that people may have heard of.
Well, first of all, the beginning of navigation happened at Harlem Hospital in New York. And at that time, Dr. Harold Freeman looked at the number of patients that were coming in with advanced cancers. And he decided to make a difference by having two groups of patients, one that was served by what's called a lay navigator, meaning not a nurse or a social worker, but someone that could contact the patient and say, you're due for screening, you're due for your mammogram, or we knew that they had abnormal mammograms, but were afraid to come in for follow-up. So what he did at the end of this 2-year study was looked at the fact that those patients that were assigned a navigator really had a decrease. He was able to downstage to stage 2 disease as opposed to stage 3 and stage 4 with patients that had that helping hand, so to speak. Mm-hmm. So in navigation, the official definition for a professional navigator is either a social worker, a master's prepared social worker, or a registered nurse. So 2 licensed people. Mm-hmm. However, navigation as a word is kind of like 17 hands on the elephant's skin. They look at, well, one time I checked in the Marriott, for example, and they had, instead of the concierge, it was a navigator. And I thought, you're not a navigator. The navigator in healthcare mm-hmm. is someone who helps patients by decreasing barriers, improving communication, getting the patient the information that they need to be able to make informed decisions and to be a sounding board. One of the things I'm very excited about with the Global Liver Initiative is that many of your educational materials are in different languages.
Yes.
So that is a huge, huge benefit to patients. Many healthcare, much healthcare information is not in someone's native language. And I think we've got a lot to work on with that. So with respect to navigation, there are some people get it very confused with, like, what is a case manager? Mm-hmm. So a case manager is typically working for an institution and helps people with discharge planning or helps them mm-hmm. with a particular episode. In the case of many nurse navigators in oncology in particular, mm-hmm. there was someone for the entire trajectory of their treatment, from screening to diagnosis, and those handoffs happen. So for example, when I was working in a breast clinic, I
Mhm.
had the patient come in, saw them before their biopsy, gave them their biopsy results, and also in the interim, in that 3-day, very critical waiting period for the patient's highly emotional time, I was able to contact the primary care doctors, find out if there's any additional testing needed, such as an MRI, all those kinds of things to prepare the patient for the next step so that they didn't feel like they
Mhm.
always knew what was going to be happening. In other words, I would tell patients, I'm going to talk to you about what I think that you are going to need for the
Mhm.
next 24, 48, 72 hours. And then we're going to talk about what you're going to be doing 6 months to a year from now. And they'd look at me and they'd say, you mean a year from now? And I say, yeah, a year
Mhm.
from now when you come back for your follow-up. So it's really inspiring hope and being that communication conduit in a very fragmented healthcare system.
That's huge. I think the closest equivalent some of our viewers may recognize or have experienced is our transplant coordinators, who do something similar.
Yeah.
Um, but it would seem that every patient would need, certainly once you have one or more complex conditions or something as serious as transplantation or cancer, would need a nurse navigator.
Mhm.
Does every hospital have them?
No, every hospital doesn't have them. And I think that it's clear that when you start to look at the business cases for them, for the navigator, it's clear we decrease hospital length of stay, we improve patient outcomes, we are able to um, really assist that patient in navigating, even for patients. So for example, I came back to the San Francisco Bay Area
Mhm.
because of a patient who lived in a very rural area in Montana. And because I had known the liver transplant people and the liver
Mhm.
people in San Francisco, having been there before, I actually was able to contact this patient was told by her primary care doctor not to worry about her elevated liver enzymes.
That happens way too often.
And I said, well, I think we probably need to do some follow-up. So what happens is I was able to contact the head of the program in one of our large healthcare hospitals in San Francisco, sent him all the information that I had on
Mhm.
the patient. And then he basically took it from there, said, I can see the patient next
Mhm.
week. Everything that we need to this point on has already been done. Let's get her in for an evaluation. And I actually ended up back in the Bay Area because of that particular patient. She really didn't know where to go, and her primary care doctor wasn't able to figure out in that rural setting where she should go.
Mhm.
When I think about primary care doctors in particular, they are so responsible for so much that the
Right.
navigator can be specialized in helping, that being the hub of the wheel and actually helping them put a whole picture together. Same thing happens when patients go to large centers. So, for
Mhm.
example, MD Anderson or Mayo
Right.
Clinic or Memorial Sloan Kettering or any of
Right.
these major cancer centers, a
Yeah.
navigator back at home, particularly in a rural area,
Mhm.
can be, again, that conduit of communication between the academic center or and the community cancer care program.
Right. I have to, I'm smiling because I have literally gotten lost in Mayo, physically lost. The care was very well, coordinated and put together in terms of my clinical itinerary, but I did get physically lost in that large facility. And so navigation of all sorts is really helpful, but particularly when you are scared,
Yeah,
when you're unfamiliar with the healthcare system, when you are trying to put together multiple pieces of a puzzle, you're really least able to
right.
do that type of advocacy and puzzle making for yourself, and the family members are often as confused and as tired, and are looking after their patient, their person, and so you become a really um, vital resource for
Mm.
them. I wonder that if a medication had the same effect, um, as nurse navigation. We wouldn't even question paying for it, and yet barriers to making sure that there are nurse navigators at every center would seem to be short-sighted.
Yeah. And there's navigators that basically are very subspecialized, as you talked about with the transplant coordinators. They are critical. But even before that, how you get the patient to where they need to be, like wayfinding for that patient. And I think that's the beauty is a navigator, particularly in the situation I was in, which was a freestanding cancer support, now a cancer support community, that basically we could, from Montana, send patients to the Huntsman, to Mayo Clinic, to Seattle Cancer Care Alliance, to wherever we needed. And that keep in mind that the benefit of, particularly in oncology nursing, there's 39,000 oncology nurses in the United States. So they're a part of the Oncology Nursing Society. So I may not know in Boston the best place for somebody with a mesothelioma to go to, but I know who to call that would know who is the best person.
Those networks are essential. You've been doing this for a long time. You came to this as a teenager. So tell us what attracted you to these types of issues at a very young age.
Well, personally, my mom went to nursing school when I'd always wanted to be a nurse. And then my mom went to nursing school when she was 51. And so I, as a young candy striper volunteer, would go with her and work every summer in, at the time, a head and neck cancer surgery unit, where I was the only candy striper that was ever allowed to work in that unit. And all the patients they had huge surgeries called radical neck dissections. And so they were completely bandaged, except I could see their eyes. And I knew at that moment that I wanted to be a voice for cancer patients, because I can't imagine being in a situation, not being able to eat, not being able to speak, not being able to, and the only way you can communicate is through your eyes. Now, obviously, technology has improved that tremendously, that people have the capability now of cell phones, of all sorts of, equipment that helps patients communicate. But even with the equipment that we have, the human touch, the human voice, and particularly patients that need so much care, coordination, is what drew me to oncology. It's interesting because you look at the relationships that oncology nurses or in the liver programs, those relationships are longstanding. It's not as if a patient comes in, delivers a baby, they may not see that patient again for a few years, or ever if they decide to have one child, or someone fractures a bone. It's in and it's out. With a chronic illness, that illness it has acute exacerbations and then, stabilization. And it's nice to know that those people have someone that knows their case and knows what they've been through, and can be there with them through the whole journey. Absolutely. I can't say enough about how important it is for patients if they have access to getting My Health Online and communicating in that way. Because one of the things that happens is that some of the hospital systems have Epic, some of them have other electronic health records. And that is a critical roadmap that patients need to utilize. But again, it's knowing about even getting online, or even knowing how to use that, or even having somebody who's computer literate enough to help somebody set up a password. I think in this world of high tech, we lose sight of the fact that some patients don't have access to internet, don't have a cell phone. I particularly am so honored and impressed by the Global Liver Initiative, because what you do all over the world makes a difference.
Thank you. And you pointed out one of the realizations that we made as we were training some of our patients, our peer mentors, who go back into their communities, whether in the US or in different countries, that digital literacy needed to be part of that peer mentorship as we were working to sign people up, as you said, to get a password so that you could access your portal or to access vaccines. Often they needed to have electronic access to an app or something at a pharmacy. And I remember sitting in one pharmacy and seeing particularly Black and Brown seniors turned away while I was helping a patient get online. And I asked the pharmacist, how often does that happen? And she was saying every day, all day long. And so that was a key insight for us. And I thank you for reinforcing the insight of the number of languages that our materials come in. That to us is the benefit of working with folks like yourselves to really tell us what's needed, what we can create that is valuable, that will help you do your job better, and to help patients and patient families. Our nimbleness in being able to create things. I really appreciate, how responsive our team is. So if there's a language that we find needed, let us know. Or if there is a type of resource or education, a list of, questions that you get really frequently that people ask that we can help make available on a larger scale, we want to be able to do that. And that's what partnerships like this allow us to do. So thank you. And I certainly see why you would be the recipient of the Biden Cancer Initiative's Fierce Award. You are fiercely passionate on behalf of your patients. What do you want the future of nurse navigation to look like? What should other fierce nurse navigators be advocating for? And
I think I wish everyone with a chronic illness had a navigator. It doesn't necessarily have to be a social worker or, as you talked about, peer mentors. One of it would be that patients knew where to call. Patients knew how to access. When you're frightened, as you pointed out, it's very immobilizing. And I think the empowerment of just knowing that there's someone that you can contact. So specifically to answer your question, my prayer would be that everyone has access to a navigator or knows who a navigator could be, how to find one, how to ask for one. For example, insurance companies have navigators.
Right.
Patients don't know that. They can call their insurance company and someone is walking them through something because so much needs to be pre-approved before patients can have things accomplished. And so, but how do people know that? I think the other powerful message is, you're a quintessential example of that. You're paying it forward. From your own experience, you're helping so many other people because you've walked that walk. And you're incredibly inspirational about it. And I think that that's the other thing is we can look at the number of cancer survivors that are cured in this country and say, how could you give back to somebody else? Right. And so we know when survivors do get involved in helping in whatever way they can help, we know that their quality of life is improved tremendously. So it's kind of like if you look at a pebble and it ripples, and ripples, I would like a lot of ripples. That's what my vision would be.
I'm happy to be part of the ripple effect. One of my clearest memories is being in the hospital for just a short rejection episode, and my doctors sort of kicking me out of bed to go talk to another patient down the hall that they were trying to encourage. And you talked a few moments ago about the time frames that you stay with a patient and that are involved. And I think one of the ways that experienced patients can partner with nurse navigators is giving newly diagnosed or patients who are early on in the process a sense of what life looks like a
Mhm.
little ways down the road. I'm 28 years down the road, and I didn't realize that how just that surviving and thriving can be so helpful for people
Mhm.
who sometimes can't picture a future for themselves.
We had a program I set up we did a vision board with
Hmm.
patients and said, what is it that you want? And we were talking and somebody said, well, at some point in time, I remember you saying, Cindi, you said, we need to get you a little bit farther out of the nest. And
Hmm.
she said it, I was terrified. And then all of a sudden I said, you've got these wings. So we
Hmm.
set up a program called Wings, Women Inspiring, Nurturing, Giving, and Supporting One Another.
I have
And
that.
it's a peer program where we do an 8-hour training. And basically they don't give medical advice. They don't drive
Hmm.
patients, but they're there to help. Like our very first patient that we had in this program was a 25-year-old non-English speaking patient
Hmm.
whose husband left her and right after she was diagnosed, that she had a 6-year-old at home and a 2-year-old.
Hmm.
And so basically our very first patient was paired with someone who worked in, this is a great story. She worked in, she's our volunteer. She
Hmm.
herself had bilateral mastectomy. She chose to. So she
Hmm.
would go and sit with this patient during
Hmm.
her infusions and be able to be a conduit in terms of education. And basically, this volunteer worked at a local junior college in
Hmm.
finance. And the last news I got is that this patient, that was the young patient that didn't speak
Hmm.
English, went on to go to school and and learn English and
Hmm.
actually finish college. So those are kind of kind of a story of what it's more than your disease. You're more than your
Right.
disease. You're, and I think that that's what volunteer patient navigators can be.
Absolutely. Absolutely. I think that being able to see a step beyond when you are so sick, and I know I've had those moments. I had some of those moments last week when I was like, I'll never be well. I'll never have energy again, it'll never. And I'm just grateful for the arc of time that have allowed me to, I'm like, this too shall pass, and I will be fine again, and I will have energy again, and I'll get back to the gym. But before I'd gone through so much, I didn't know that that was true. I couldn't hold that in my head or my heart because I hadn't yet experienced it so many times.
Mhm.
And so just to give that to someone else is such a great privilege, and is healing in and of itself. And so my message is to others who were thinking that they don't have anything to offer. You have yourself, and you have your story, and you may have quirky skills that nobody ever mentioned. Like, I don't mind getting needles. I've had a lot of phlebotomy, so I'm happy to sit with someone while they get blood work or an infusion or
Yeah.
something like that, because I've had so many and I don't flinch. And so I'm happy to sit with someone who's afraid of needles. And that's not something that's on my resume, but it's it's a really useful patient and patient advocate skill to have. So I'm happy to sit with someone and just talk them through their blood work or infusion, if that's what they need from me. And people have so much more to offer than they think, having gone through a life-changing experience like cancer or transplantation. And those are just wonderfully complementary, I think, to the nurse navigation
Mhm.
that you do. And so you also have you've written a book, you've done wonderful things. We could talk about them for ages. And my team who prepares me for this gave me like quotes of chapters and things to read. But one of the things that you wrote in chapter 1, an overview of nurse navigation, as if you've memorized your own books. I love when people tell me things that I've said. I was like,
I, I
did
would
I
didn't
did I
author
did I
the whole
say
book.
that?
I was a
Okay.
co-editor and author. So go ahead.
if you say I said it, that sounds great. But I appreciate that you talk about delivering patient-centered care across the continuum. And you wrote that some viewed it only as a Band-Aid for enormous failures in health systems, communications, and lapses in professional nursing leadership. How has it become, or can it be more than just a Band-Aid?
Well, I think with the pandemic, I mean, we clearly learned about many of the gaps and the issues we have in our healthcare system. And I think when navigation started, it was considered a Band-Aid just because of the fragmentation of care. You know, I remember a woman who said, my daughter is under the care of a pediatric neurologist, a radiation oncologist, a pediatric medical oncologist, a psychologist, a psychiatrist, and a general pediatrician, but I don't know who my daughter's doctor is.
Mm-hmm.
So it's like, how do we, how it was perceived as a Band-Aid is just that conduit. And now we know clearly through the literature that there's decreased anxiety, that there's, as I mentioned before, decreased length of hospital stays, more awareness. I don't see it as a Band-Aid. I see it as an essential part of care. The challenge, frankly, we have is that the healthcare systems, I'm not sure uniformly look at it in the same way that I look at it. In other words, of the whole financial piece and reimbursement. You know, nursing has never really costed out its services. So most of what happens in healthcare is incentivized. There's a payment for a physician or a nurse practitioner, or a PA or whatever. But that's the beauty of a navigator in the sense that I hopefully am attached to helping that patient wherever that patient may be. It becomes a little bit more difficult when you're embedded in a system that you only can make referrals within that system. So to answer your question about the Band-Aid, I think it's changed a tremendous amount and there's more recognition and clearly there's more navigation than ever before. But I also feel like we need to do even more. There'll never be a time when there's not enough or there's too many navigators, I believe.
I agree. I absolutely agree. You know, the scenario that you described is so much more common than people realize. And the hardest thing about having a medical team, if you will, is having them realize that they're on the same team. And act and share information. Often that patient is sort of left alone as you know, the health information exchange and the sort of the keeper of all the unified knowledge. And that's just too much when it's a lot when you're well. It's just too much when you're sick. And so having that nurse navigator to be that unifying force and that sort of giving you that roadmap in ways that you can accept it and digest it, not like this is your entire journey, good luck. But here's this part and then the next part and I'll be with you on that part. That's really so valuable, and often so missing in so many different types of healthcare scenarios. We often get, this is what's going to immediately happen, like while you're in the hospital, and then you'll be healed 18 months later, and you're left, well, what's going to happen within those 18 months? What am I supposed to do? What am I supposed to do every day in between? How am I supposed to feel in between? Is this right? Is this wrong? Is this normal? And to have someone that you can ask, that you feel comfortable asking. Often you don't feel comfortable bothering your doctor about that, even if you knew which one to bother. So I thank you. And I
think there's going to be some big changes. I mean, I haven't read it yet, but CMS is now looking at reimbursement. So I think that there will be a change because we're all in this together and there needs to be sort of a a collaborative, there's a great model Stanford put out called collective impact.
Okay.
And so what we could do collectively with one another, recognizing each other and sharing that workspace, so to speak. And I also think it's encouraging to patients to make it, allow them the kind of control that they feel so out of control with this disease.
Right.
And I say to patients, it's like a project, like you're going to be doing a project that you need to have your own personal board of directors.
Mm-hmm.
Like you could have somebody manage the bills. That's the big issue that people face all the time. Somebody else could be doing, running to do some personal things like, find somebody that can be your person that could pick up the kids from school. So really be able to look at a board of directors that helps you manage an unwanted cancer project.
Absolutely. But I think you also, I want to end on just a step back on what our advocacy goals can be looking forward. So CMS is a place that we should be making sure that that these services that we find so valuable are reimbursed for everyone in every state, and I think we should include in the show notes the Stanford model so that people will know what to look towards and what to ask for and how to raise expectations. I'm on the board of a hospital that has a cancer center. There are many of the, GLI A3 advocates who are in increasing positions in healthcare. And so having those models to look for so that we know what to advocate for is so essential. So thank you for that.
And healthcare systems are asking all the time, what does a navigator look like? What should their training be? There's lots of, the Oncology Nursing Society has certification guidelines, credentialing, educational competencies, how you really look at establishing a navigation program. So there's a lot of resources there. George Washington has a great program for lay navigators. So it's just a matter of knowing where to go.
Well, we'll help more people know where to go. Thanks to you. Thank you so much.
Thank you.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.